Good afternoon and welcome to the UCLA Center for Health Policy Research's monthly webinar series. Sorry, we're dealing with a little echo in the room. We're getting rid of. All right, thank you. First off, I'd like to make you aware of what we're going to be discussing next month, a little tease. As you may have noticed, there is still a lot of discussion about the Affordable Care Act and health insurance coverage for Americans at both the federal and state levels. On May 23rd, Dahai Yu and Petra Rasmussen add an important piece to this conversation as lawmakers consider the future of the health insurance markets. They will be presenting a look at Medicaid expansion under the Affordable Care Act, because while the expansion has benefited many Americans, it has not been consistent among all racial and ethnic populations. Specifically, they are finding that Hispanics have realized the least benefits from expanded coverage. Please join us here at noon on May 23rd to expand that conversation. Today, however, we will be talking about health habits, specifically the consumption of sugar-sweetened beverages among children. While years of research on the negative impacts of sugar is building, we are not necessarily seeing a corresponding decline in consumption. Beverages with added sugar, such as soda and energy drinks and those very popular sports drinks, are the largest source of added sugar in the diets of both children and adults in the United States. We all know that adults and teens consume lots of sodas and so-called sports beverages, but our researchers are finding that children, even as young as 2 years old, also consume significant amounts of unhealthy sugary beverages. So in today's seminar, Dr. Susan Babey, the co-director of the Center's Chronic Disease Program, and her co-author, Dr. Joelle Wolstein, a center research scientist, will discuss the findings from their latest study of sugary beverage consumption among children here in California. As for today's seminar, we are recording it and it will be available on our website at the end of today's seminar. I'm sorry, I was supposed to be advancing slides. You will see there's the address for the place where you can find the seminar after today's live presentation. And if you are watching it online and you would like copies of today's slides, you can email Tia Lei, which her email address is also on the slide available. And now, without further ado, I turn it over to Dr. Susan Babey for today's discussion. Thank you.
Thank you, AJ, for that introduction. I'm going to start with a brief overview of what Joelle and I will be covering today before we get into the meat of the presentation. I'm going to start with some background information about sugar consumption and its health effects and patterns nationally. Then we're going to turn to our results about sugary beverage consumption among children, which will include a closer look at high consumption among children. And then we'll wrap up with conclusions and some recommendations. So, as AJ mentioned in her introduction, there's been a lot of work about the negative health effects of consumption of sugar and sugary beverages. Drinking beverages with added sugar has been linked to several negative health effects, including overweight and obesity, increased risk of type 2 diabetes, heart disease, non-alcoholic fatty liver disease, tooth decay and cavities, as well as consumption of less nutritious foods, reduced consumption of more nutritious foods, such as vegetables, fruit, and milk. So several national and international health organizations have recommendations about limits on consumption of added sugar. The U.S. Department of Agriculture, which is responsible for the dietary guidelines for publishing the dietary guidelines for Americans, and the World Health Organization, or WHO, both recommend limiting intake of added sugar to less than 10% of calories consumed. And this is because of the health benefits associated with limited consumption of sugar. However, the WHO also has an ideal limit of upper limit of 5%, which they argue will result in even greater health benefits for countries that are able to strive for that higher or lower, I should say, limit. And then the American Heart Association also joins the WHO in promoting a 5% upper limit for optimal health. So to translate the American Heart Association recommendation into terms that might be easier for most people to measure, the American Heart Association recommends specifically for kids that they consume less than 25 grams or about 6 teaspoons of added sugar in a day. Now, added sugar can come in a lot of different forms, and some of them may not be easy to recognize if you're trying to look at an ingredient label. So, for example, the ingredient labels may not list sugar exactly, but they might list other terms like high fructose corn syrup, molasses, cane sugar, corn sweetener, raw sugar, syrup, honey, and most ingredients that end in OSE or OS, dextrose, fructose, glucose, lactose, maltose, and sucrose are all other names for sugar that you might not easily identify as sugar in a product. So, how much added sugar are we actually consuming? Well, in the United States, this graph shows the average intake of added sugar among U.S. males and females as a function of age, and the recommended maximum limit appears as that dashed blue line across at 10%. And you can see that all ages exceed this recommended daily maximum, but that it peaks in adolescence and young adulthood, and then gradually decreases again with age. But at no point, even at age 1 to 3, is the average consumption below the recommended limit. Now, what's contributing to our consumption of added sugar? Well, sugary beverages are by far the largest source of added sugar in our diets. Almost half, 47%, of the added sugar that we consume every day comes from beverages. This is followed by sugary snacks and sweets at 31%. And within that 47% of added sugar coming from beverages, most of that comes from soft drinks like soda and sugar-sweetened fruit drinks, as well as sports drinks. So, to give you an idea of why sugary beverages contribute so much to our intake of added sugar, and also to illustrate why drinking these beverages makes it so hard for kids to stay within the recommended limits, here are a few examples of sugar content in common sodas. I'm also going to show some sports drinks, energy drinks, and fruit drinks and fruit or flavored waters. The common servings of these drinks in every example that I'm going to show all exceed the recommended limit of 25 grams of added sugar for kids. So all they have to have is one of these drinks in a day, and they're over their sugar limit. So in this example, a can of cola contains 39 grams of sugar. 12-ounce can, that's a typical serving. And a can of orange soda contains 49 grams of sugar. All right, and although sports drinks may contain less sugar per ounce, they typically come in larger serving sizes than soda. So most commonly they're available in either 20-ounce or 32-ounce bottles. And a 20-ounce bottle contains 34 grams of sugar, and a 32-ounce bottle contains 53 grams of sugar. So really large amounts of sugar. Another common source of added sugar in this beverage category can come from energy drinks. So energy drinks are typically served in cans that are a little over 8 ounces, or cans that are 16 ounces, depending on the brand. An 8-ounce can contains 27 grams of sugar, and a 16-ounce can contains 50 grams of sugar. And then finally, some more examples that often might seem like a healthier alternative because of the word fruit or the word vitamin, but these flavored fruit drinks and flavored waters can also contain large amounts of sugar. So in this example, a 16-ounce bottle of pink lemonade has 49 grams of sugar, and the 20-ounce bottle of vitamin water, this flavor contains 33 grams. Most flavors contain either around 31 or 32 or 33 grams. So this gives you an idea of why these sugary beverages contribute so much to our consumption of added sugar, particularly for kids who should ideally be limiting their intake to less than 25 grams a day. So now to turn to our study, we use data from the California Health Interview Survey, primarily from 2013 and 14, but also going back to 2003 to present some information about trends over time for these younger kids. In 2013 and 2014, CHIS conducted interviews with over 40,000 households in California, including interviews with more than 5,500 children, or I should say about 5,500 children. The adult most knowledgeable about the selected child, which is usually a parent, responds to the interview on the child's behalf. Interviews are conducted in every county in the state and in 7 languages, including English, Spanish, Korean, Chinese, both Mandarin and Cantonese, Vietnamese, and Tagalog. The weighted survey data are representative of the California population living in households. And the survey includes questions on health status, health behaviors, as well as demographic and social characteristics. So for our study, we use data from 4,901 children, ages 2 to 11. Parents of children younger than 2 are not asked about their children's sugary beverage consumption. So hopefully it would be quite low or ideally non-existent, but we didn't ask. So, but for our study, we used responses to a couple of different questions. So parents reported about the number of glasses or cans of soda that their child drank yesterday, or the number, or I should say, and the number of glasses or cans of sweetened fruit drinks, sports drinks, or energy drinks that their child drank yesterday. Our measure does not include 100% fruit juice, and it does not include diet drinks. So we found that overall 31% of children between the ages of 2 and 11 drank a sugary drink every day in 2013 and 14. This percentage is higher than that for those drinking sugary drinks every day in 2009 or in 2011 and 12. Between 2003 and 2009, we did see in California that the proportion of children drinking a sugary beverage every day decreased from 49% to 26%, but since 2009, the number has been increasing again. This graph shows these trends broken out by age for children ages 2 to 5, that's the blue line, and children ages 6 to 11, that's the red line. You can see that children ages 6 to 11 are drinking sugary drinks in higher proportion than children ages 2 to 5. However, the increase between 2009 and 2013-14 is more marked among the younger kids than it is among the older kids. So that is definitely a troubling trend. So this reversal of the downward trend that we had been seeing in California for several years in terms of sugary drink consumption among kids is concerning because of the potential health impacts. And so what we're going to do now is take a little bit of a closer look at the consumption patterns of these kids ages 2 to 11. So this graph, or pie chart, I should say, shows the breakdown of the number of drinks consumed per day among this age group. And so the good news is that even with these recent increases in sugary beverage consumption, most kids, about 70%, are not drinking sugary beverages on a daily basis. However, we do see that 5% of kids ages 2 to 11 are drinking 2 sugary drinks every day, and an additional 4% are drinking 3 or more every day. So those are really high rates of consumption, especially for very young kids. At this point, I'm going to turn things over to Joelle, my colleague, who is going to present some more results related to patterns of sugary beverage consumption among these 2 to 11-year-olds.
Thank you, Sue. So I'll be presenting data on disparities in sugary drink consumption, as well as the relationship between sugary drinks and other health behaviors. So first, we looked at sugary drink consumption by income as a function of the federal poverty level. And we found that children in the 2 lowest income groups, so 0 to 99% of the federal poverty level and 100 to 199% of the federal poverty level, were more likely to drink sugary drinks than their higher income counterparts. We also looked at racial and ethnic disparities and found that higher proportions of African American, Latino, and Asian children consume sugary drinks compared to white children. So the data I just presented, these results were based on a dichotomized sugary drink variable of 0 versus 1 or more sugary drinks per day. But as you saw from the results that Sue presented, nearly 10% of kids consume 2 or more sugary drinks each day. So we looked at disparities for 2 or more sugary drinks per day as well. So when you look at income disparities, you see that children in the lowest income group are the highest consumers of sugary drinks at 2 or more per day. So 13% of children in the lowest income group consume 2 or more drinks per day. So also when looking at the breakdown by race ethnicity, African American children, 32% of African American children consume 2 or more sugary drinks per day. That's almost about 8 times as many as white children, and 10% of Latino children, over 2 times as many as white children consume 2 or more sugary drinks per day. We also looked at the relationship between sugary beverage consumption and health behaviors and found that sugary drink consumption is related to fast food consumption. So about 10% of kids who eat fast food 2 or more times per week drink soda 2 or more times per day. And this doubles among kids who eat fast food 3 or more times per week. When it comes to sedentary behaviors, we see similar trends. So children who spend more time in sedentary activities both during the week and on weekends are more likely to drink sugary drinks 2 or more times per day. So to summarize our findings, the percent of children consuming sugary drinks is on the rise, as Sue showed you for the breakdown of the 2 young children groups. And also there are disparities in sugary drink consumption, particularly among those consuming 2 or more drinks per day. And we've also found a relationship between sugary drink consumption and other unhealthy behaviors like fast food consumption and sedentary time. While there have been many efforts by advocacy groups and local government agencies to reduce sugary beverage consumption, there's definitely more work that is needed. Some examples of policies that could propel these efforts forward include ensuring access to safe drinking water in places like parks, schools, and other places where children spend quite a bit of time. Limiting marketing of sugary drinks to children is also an effort that we've seen over the years, but that could definitely be improved. And providing accessible information on added sugars, such as the amounts of added sugar in beverages, whether it's on actual bottles of sugary beverages or different points of sale, is also something that could be done. So we would like to thank Pan Wang for her statistical support on this project and the California Endowment who provided funding for this work. We would also like to thank Tia, Celeste, and Hala for helping to coordinate this seminar. And as AJ mentioned earlier, the fact sheet related to this seminar is available at the center's website, healthpolicy.ucla.edu. And here's our contact information. And I will leave you with this encouraging slide or image next to a water fountain, because we all know that we deserve more than water. Thank you.
Okay, so the way that we're going to handle the Q&A session is to bounce back and forth between questions that are coming from online participants and those who are in the room. I have a question to start with from online, and so those in the room, gather your thoughts, and we'll be with you in just a second. First question for our authors. Were the same findings relating sugar-sweetened beverages consumption to fast food consumption and sedentary behavior true looking at the dichotomized variable of one or more sugar-sweetened beverages per day?
I can't remember off the top of my head. I think we saw the same general relationships, but the discrepancies were not as large with the one or more as they were with the two or more variable.
Great, thank you. Now, do we have a question from someone in the room?
Is there any explanation regarding the downward trend and then upward again? Is that related? Because I mean, it's kind of related to the economic downturn, and but I don't know.
So there are a number of factors that could explain that shift back up. And one of them could be the economic downturn, because you see that it happens right around that time. And as you saw, lower income children are more likely to consume sugary beverages more frequently than higher income children. It could also be related to factors like marketing and shifts in marketing patterns. So as the soda companies have seen that people have become aware of sugars and also artificial sweeteners, they've ramped up their marketing of other sugar-sweetened beverage products, such as the ones that Sue gave examples of in the presentation, like flavored waters, iced teas, fruit-flavored drinks. So that could be another explanation.
Thank you. Question from online. Is there any available data on locations like Berkeley and other locations with soda taxes?
So that's a very good question. We don't have data specific to Berkeley, but there has been some initial research that suggests that the tax in Berkeley, at any rate, was related to reduced purchasing of sugary beverages within the city. And I can't remember. There's also results from research on a tax that took place in Mexico that also had results suggesting that the tax may be having the intended effect in terms of reduced purchase of sugary beverages as well as reduced consumption.
Question from in the room.
I'm interested in the difference between added and natural sugars, and I know you excluded 100% fruit juice, but the effect on the body, I think, is controversial, or some people dispute that there's a difference on the body. And so, did you look at specific data to choose to exclude fruit juice because that's still a ton of sugar, or was it a choice to limit the study?
So you can go ahead. Okay. Well, I think part of why we didn't include 100% fruit juice is that we wanted something that was a measure that was truly non-controversial. However, it is true that there is quite a bit of sugar in fruit juice, and the nutritional value of fruit juice is likely somewhat limited, particularly when the alternative would be an actual piece of fruit, which would definitely be preferable to the fruit juice. I can't remember the rest of the question. Did you want to add anything, Joelle?
Do you feel that answered your question?
It was just why you chose not to include that in your study, to say, look, we're not going to count 100% fruit juice into these sugary beverages.
Right.
Was it because of the non-controversial nature of that?
Yeah, and we were really focused on beverages that include added sugar, so it gets at your question about added versus natural sugar. But there is a lot of emerging research suggesting that even the fructose that would be in fruit juice has similar or maybe not similar, but still negative effects on the body when we consume it. But I think that's still an emerging issue. So, yeah.
Great question from online. Have you been able to link intake of sugary drinks and childhood obesity?
So we didn't look at that specifically in this study because our data are cross-sectional, and for young kids, we have parent report of height and weight, which are not super reliable for linking with factors like sugary beverage consumption. But there is a large body of other research that suggests that the two are linked.
Thank you. Question from in the room.
Thank you. Just a point of clarification first. 100% fruit juice is even different than 100% juice. There's a distinction between the two, which is kind of interesting as well. But I assume you got both of those in your category.
Right. Yeah, 100% juice of any
Right.
type was not included in our sugar.
Question I have for you. I've read studies where the beverage industry specifically targets racial groups, especially African American children. I think that's pretty well established. But is there any research that you've been able to ascertain that shows a causal link between that advertising and the remarkable increase of consumption with that group? Obviously, the correlation is pretty clear, but is there any causality evidence that you've come across in your research?
So I know of one study that suggested that I forget the exact number of hours, but a certain number of hours of exposure to ads among kids was associated with a 10% increase in sugary beverage consumption. So I think there is research out there. That's the one study that I can think of. I don't know if you know.
Yeah, I know there's quite a bit of literature about advertising targeting specifically African American and Latino groups. in terms of whether that data is cross-sectional or longitudinal in order to establish causality. I don't recall off the top of my head, but certainly there is a correlation, as you mentioned.
And we had a question online, timely enough, along the same lines that may perhaps inspire some of your future work. The question is, have you studied what approaches to limit marketing would be best for reducing consumption of sugary beverages? I'm going to assume your answer is not yet.
Correct.
All right, so the next question online is there any data on 11 to 18-year-olds who have the ability to buy these drinks for themselves?
There is, and stay tuned for a policy brief that's being released at the end of May with some very interesting information on older children or teens.
Mm-hmm.
Wonderful. Another question from online. Did the researchers explore looking at geographic differences in consumption, and also was water consumption assessed?
So in terms of water consumption, I don't believe that it's measured among young kids. It is measured in adolescents, however. But I have not looked at that data recently.
In terms of geographic differences, we present them in the fact sheet for the largest counties in the state of California, and we have some older data online by county.
Wonderful. So that will be on our website if you want to check out further information on the geographic differences among sugary-sweetened beverage consumption. I'd also like to add a voice online that there was another interest in questions about access, including where did the participants get the beverages that they are consuming, and another suggestion for potential expansion on this research. Are there any other questions in the room? Yeah, hang on just a second.
I just wanted to ask about how did you come to those conclusions based on your study? I didn't see quite a relationship between your findings and the recommendations that you made.
Well, the recommendations were really just pulled from the literature around factors that might help reduce consumption. So based on our study, we would conclude that we still have a lot of work to do to reduce sugary beverage consumption among kids. But going beyond that, based on the literature and other work that's being done around reducing sugary beverage consumption, those are just a few examples of policies that may be helpful.
Okay, another question from online. Would you know of any studies that have looked at limited access to food and the relationship of the increase in sugary sweetened beverages, i.e. are families attempting to replace lost food calories with those in the beverages?
There is research looking at things like food deserts or availability of different types of food stores in communities, and in fact we have some older work that's looked at the relationship between the food environment and overweight and obesity. There's also other research that suggests that the food environment is related to consumption of sugary beverages, increased consumption of sugary beverages, reduced consumption of fruits and vegetables. So I think it's likely that that is a factor that's related, yeah.
And another comment and question from online, responding to some of the comments that you've already made. Are you saying that for future recommendations that how much sugar is in a beverage might be on the container somewhere other than just in the nutrition facts label? They ask since that we know that the nutrition facts label will now list the total grams of added sugar and a product contains under carbohydrates.
Mm-hmm. Yeah, so that's a very good question, and And I think that in addition to the information on some products that includes like the total calorie count on the front of the product, other key pieces of nutritional information featured more prominently could also be helpful, including not just sugar, but other things like sodium that are really problematic for health.
I think also something that could make it more apparent how much sugar is in a beverage is not splitting it up by serving size when there could be 2.5 servings per beverage in that size container, but actually showing the complete amount of sugar in that container, because I don't think most people get a bottle and drink just the 8 ounces in the serving. They drink the whole thing.
Excuse me. Any further questions in the room? Well, then I'm going to take a moderator's prerogative and ask what might be the final question. If policymakers are watching here today and are going to read the report that you all are putting out, what is the biggest takeaway you hope that they have?
That's a good question.
How long do we have?
So, you know, I think the biggest takeaway is that doing nothing should not be an option. So the question of what should be done, I think, is going to vary depending on where you are and, you know, what the community you're working with is. But because as we've seen with things like passing the tax on sugary beverages, some places are open to that kind of policy and other places are not open to that kind of policy. And so it's a matter of finding what can work where you are. But yeah, I would say doing nothing should not be.
Something needs to be done, and soon.
Great. Thank you. Well, thank you all very much for joining us for today's great conversation, and I hope you will join us back here on May 23rd at noon for a discussion of how Hispanics are faring under the Medicaid expansion under the Affordable Care Act. Thank you. Thank you.